recognize complications associated with diabetes and hypertension, and also to identify key risk factors contributing to the development of these conditions, including genetic predispositions, lifestyle choices, as you mentioned, and also socioeconomic factors, as you mentioned. Say, some we can't do no better about eating starchy foods, right? So what is it? This is a condition where the body can't properly process blood sugar due to issues with insulin production, right? We all have insulin inside to produce that, so when it not work, problem. We have the blood build up. And because of that, the increased carbohydrates when we eat, and the sugar can't come out. This is me using layman term now for you guys to understand. So when it can't come out now and there's a built up, then that's when we talk about the high blood pressure. But why that can't work is because the pancreas to release the insulin is not working. You follow me? All right, good, good. There are mainly two types. There are mainly two types. All right, no worries. Yeah, yeah. You sending to me? Yeah, because I look back every minute. All right, no. So we're recognizing how we recognize when our sugar is low. Shakiness. Yeah, man. When the sugar low, we are talking about when the sugar low now. How you can identify, how you can look on somebody and determine if you know the person have sugar. How can you? No. How can? Hold on. Me so asking me know some bright people, you know. Me know. But me gonna put all that information here first and then ask me because guess what? Me need to know say, oh no, remember, because this is something that you guys know already, right? So when to recognize hypoglycemia, which is the same as low blood sugar, shakiness, sweating, dizziness, confusion, rapid heartbeat, hunger, blurry vision as you mentioned, weakness or fatigue, severe cases such as loss of consciousness, or some persons get into seizures. So those are some of the signs when you recognize somebody sugar is low. And when that is not being acted on, that person will fall into a coma. Yeah? Excuse me 1 minute, guys. I forgot to send the information. Give me a minute. Yeah. All right. All right. Yeah. Send it. Yeah. Oh, group. Class group. I'm so sorry about that, guys. Mr. Derek, pull it up again there, please and thanks. Boy. When you're a student, you have to answer to all of these calls, right? Yeah, man. When you reach nurse stage, you know, and can you imagine a student we talk about, you know? But anyway, in God we trust. So, so to recognize hypoglycemia, Miss Wilson, I got big pain, not nothing, I'm sorry for you. Just tell me one, just by you remembering what I said, one of the symptoms or the sign to recognize that somebody have low blood sugar.
You have heart race, and not Jesus.
attack party, but the heart of a beat fast. Right? Yeah. The heart of a beat fast. Reach heart attack party. You don't want to reach heart attack party, right? Alright. So come down, Miss Vivina, your turn now. Thing that you down here?
Yes, as I said, very hard. And then, of course, this is the night of falling out, and then not saying at all.
Slurs, speech, all these things. So when they reach a coma stage, they start to look wild. So if you notice somebody diabetic and they start to look wild, guys, don't take it lightly. Check them out. Alright? Check them out. Give them some sugar. Raw sugar. The water must well sweet. Please and thanks. So we'll look at the signs and the symptoms now when it was low. So this is now when it is high, right? And we'll call that hyperglycemia. Yeah? So we have frequent urination, especially at night. We have increased thirst and dry mouth. Unexplained weight loss, just lose weight just like that. No, me soon come in, me see a bright spot now. Me soon come to your mind. Hyper is high, right? And hypo means it's low, right? Fatigue or drowsiness. Blurred vision again. Slow. Slow healing of cuts or wounds. So if you have a cut and it takes long for heal, then you might want to check that out. So the severe causes are nausea, vomiting, or breath. It's fruity. Once you start to smell fruity, then you know say fruity. I'm gonna just, because why I'm asking this, I can just read through what is on the PowerPoint, but I want to make sure say everybody understand what I'm saying. Both of them. So you want to make sure that you maintain a stable blood sugar level, right? Yes? But here you said about penny section. Penny section we always, at my school, the penny section them get targeted, meaning we're going to always come to know. So, the penny section now. Can you tell me, if I even one sign when it is high, tell me what hyperglycemia mean?
That it's high.
What is high? Jesus is high. Mister, what's your name again?
Edward Morgan.
Mr. Morgan. Tell me one sign, just one dege sign, I want to know.
When?
One dege sign, when your sugar is high, what happened? How you recognize that that person has a high sugar?
You know when you get high, black out.
When your head get light and black out. See it there? Right there, so. So what you say now, sir?
When the sugar?
Yes, the high blood sugar.
When it high?
Yes. Oh, you know when somebody's sugar high. Just by looking at them or you can identify one of the signs.
Well, I never take that notice look on people when them sugar high, I check my one and thank God I'm taking my medication from my one all right now. Everything all right, so I give God thanks.
That's right. In everything we do, we give thanks, right? Right. And when you have somebody in the household that has, right? Yes, you have an idea of what it is, how to recognize it when it is high and when it is low, right? Right, mommy? Yes. That's correct. But we never come to you for no sign and no symptom. Tell me when it's high. Just tell me one sign, just one.
Frequent urination, especially at night.
That,
Blur vision.
that's correct. That's correct. All right. So frequent urination, she said, at night, especially at night. You're supposed to be on your medication because that is now going to bring it down and stabilize it. So if you take your medication, and if you eat too much starch, if you eat too much, Just drink a lot of water, get some rest and all of that. And make sure, say, if you feel any of those symptoms, you find the doctor same time. If it's a case where you can help to bring it down. You understand? Because what will happen is, if it is a case where you have it, you will know by now how to control it. So if you make it get out of control, then you know, say, if somebody else can help you or don't know the signs and symptoms, you need to find the doctor. You understand? If you're out of your medication, guys, please find the doctor and get the medication. Stay on your medication. All right?
If it high, you can't put a garlic in your mouth. It bring it down.
Well, they say the garlic, no. The garlic works with the pressure, you know. And you see the blood sugar, you can work with that too. You understand? But it's really mostly the pressure. But if you have ginger too, you can use ginger too, you know. Right. As for the home remedies, I mean, you all would have been exposed to it. And if it is working for you, then you work with it. All right? If you're on your medication, you stay on your medication. Right? It work for you? It work for somebody else? No, man, I pressure we are talking about. Which one we are talking about? Pressure? It work for that person there? You don't know. All right, so here what I got ask you say. So when I see doctor, I got ask you for ask the doctor. Because I want to answer you know, but it's because I'm not 200% sure, I not answer you. You understand? But more you keep that question and make sure, say, you ask the doctor. Right. Sure.
How does my body? How does the body knows that is night? Why am I free? Why free only at night and not in the day? Why mostly at night?
You're, but that is why she is studying to be a nurse. That is why. And that is why she's here. Because it's when I can't answer your question on spot, that is why she's there. Right? All right. Okay, so the trick, the number 9, who's number 9? Your time to go and see the doctor. Is you a number 9? Oh. But what I'm saying, in the nights, especially at nights, sometimes what a lot of persons don't know is that when at nights, they want to drink everything before them go in bed and all of that. Remember? Mm-hmm. So you go not drink by a certain time to eat after a certain time. Because when you do that now, you only increase the rate at which you have to get up. Remember, throughout the day, you'd have already can control and go and go and go. But at night, no, you go tend to. You understand? But try and limit the fluid intake, and not just water alone, but anything, fluid, at night, to limit the amount of time you get up to go to the bathroom. Because at the end of the day, we want you all to get your full rest. 8 hours, they say. Me no say no work all the time for 8 hours, but at the same time, the full amount of rest that you normally take to feel good the next day. All right? All right, so we're going to move on now to hypertension. What is hypertension? All right, Bright Sparks said that. Who said that down there? Oh, Miss Vivian. All right, Bright Sparks round there. So, hypertension or high blood pressure is when the force of blood against artery walls is consistently too high. This makes the heart work harder, increasing the risk of heart disease, stroke, and kidney damage. So what we're saying is, say for example, this mic, this is the vessel, right? So the blood goes through that. Once it gets small, it only means that more work for the vessel, for the blood to go through. So the force is high, so that now is an increase in the blood pressure, right? So you guys understand that analogy? Because that's what happening at the body still, you know. So this is... Doctor, no, of course. Why high blood pressure? Is why we are talking about it now? Define it a little more. All right. So we understand, say, it is high blood pressure, right? All right, so it's when the force of the blood against the artery walls. So pretend, say, this mic is the artery walls. You know you have veins and you have arteries, right? Them green things that will look point through your skin. All right, so this is the vein and the artery. The artery, let me talk about the artery. So the force of the blood now, it increases based on whatever that is affecting it. Because of all of those, right. So it causes the blood to work harder. So the force against the wall is fast. Right, and then it goes to the heart and then everything. So the heart and everything. Go rest, sit down and rest and drink some water. Sleep if you have to. Lord God. When we finish up the lesson, So you understand the basic of what it is, right? All right, good, because that's the aim, you know, we want you guys to understand and reinforce what you already know. All right, so the classification of blood pressure now. So when we say the classification, we have different levels, right? Different levels. So you have the normal, and you guys know the normal. Anybody know the normal? That's right, so that is the normal, right? Well, 120, of course, why not? But make us see now, you did do your checks and everything, right? It no matter the age.
The age no matter.
Age don't matter, right? But if it's a case where you were treating it and you're doing everything at a younger age, then everything should be okay. If it's a case where it so happened that you have blood pressure, you just need to make sure so you maintain and control your blood pressure. Control. Yeah, man, children can have blood pressure. So the pre-hypertension stage now, or the level, is between 120 to 139 over 80 to 90. So just like I should drop it on me and say 120 over 80. 120 is the top part, which is the systolic. Bottom part, diastolic. Top one, right? So when you go inside, you check the doctor. Ask the doctor more about it here. All right. So when you're pre-hypertension now, 120 to 139, this is the top number. The bottom number is between 80 to 89, right? So if you get between that range, 120 to 139 over 80 to 89, then you know, say, all right, Jesus, me eating, me have to drop down the little salt because me are going at a phase there now. So you know, want that. So you just, you know, reduce your salt intake, drink your water, exercise. Remember, exercise. Just to control it and get it back to the normal, right? If it's a case where you make it past the pre-hypertension phase, guys, the stage 1 hypertension is between 140 to 159. That's the top number now. And the bottom number is 90 to 99. So if you're reading, two of them, but the top number, more important. Yeah, but the two of them work hand in hand, right? So 140 to 159, yes, you have high blood pressure, right? No, when we know celebrating, but may I take it in stages because I make sure so everybody understand the different stage and so you know. So 140 to 159 over 90 to 99, you're stage 1 hypertensive. Yeah? And that can still be monitored as well, but you know, so you gotta go on look at medication right there. So when you reach stage 2 now, it is greater than 160. So anything above 160, the top number, and anything above 100, the bottom number, then you know, say you're full-blown hypertensive, right? So this no concern, no. This is when you want to make sure, say you bring that down because we are talking about strokes. It will lead to that. You understand? We all know that road is there, but we are focused on everything before that. Yeah. Yes. So the sugar intake. Yes, sir.
That. When your mind is stable and steady, it's no pressure.
Of course. Williamson? 1 minute, sir. Williamson? Who's Williamson? Williamson? Ooh. Hold on there, sir. All right. What is it now, sir?
Me think when your mind not steady and you fret and go in that kind of worry your mind, I send up a pressure, you know.
Of course, that's in a pressure.
I know so much food we eat and drink.
That is right. Your mental health, you have to make sure you take care of that too. Because if you put people problem on your head, pressure. Is it? No, talk me here.
The pressure.
Yes, about pressure.
229.
So you have people problem on your head?
Yeah.
Yes, we are talking. We are talking. I discuss, right? We are discuss. Not personalized. We have a discussion, right?
Of 1 week, I'm going to take a pressure tablet.
No, we don't want that on the mic. We don't want that on the mic. So, when you're going to the doctor, why you talk to the doctor, okay? All right, but at the same time, he's correct though, guys. When you overthink certain things, and you're especially depressed and all of them things there, and you put yourself in a sad state, think about everything we are going wrong, and you not even remember say you can think about something we are going right to bring down your pressure. That will also keep it up. All right, and I understand it's life, but what we have to do right now, we have to take it one day at a time. You're selfish sometimes. Oh, yeah, man, be selfish sometimes. So while we're always being selfless, we have to be selfish sometimes. And that is correct. I agree with you.
So, you talk about prostate.
We can ask the doctor to talk about that, but whenever they really build a PowerPoint plan, that still. Oh. So, but we can mention that though. So the significance of hypertension, so the silent killers, both conditions often progress without obvious symptoms in early stages, making them silent killers. So they cause major health issues and can shorten life expectancy if left untreated. Thank you. So we say both conditions, which is the diabetes and the pressure, they both are silent killers. So if we don't identify them from early, it will just come right upon us and then do what it have to do. Especially because we cannot identify it, we don't know how to treat it. You understand? And we leave it, and then it just do the body all of what it needs to do.
Which one will kill you first? High blood pressure or the low blood pressure? Quicker.
High or the low?
Long and dead, is it high or the low? Somebody like they're traveling and they just drop and dead. If it's the high pressure or the low pressure.
Which one is worse to kill you? I would say both of them, I would say both of them, but you see, when it's too high, it knocks you out quicker than the low. You understand? Because you're going to have to find a way to bring it back down more than when you can try to get it up back quick.
As we get older, right? As we get older and with less activity and all of that, defense, as you age, these things get so chronic in senior people, because I remember my doctor said to my mom, old people, when I say old people, not that should really have though, when you're young, I feel we should not be really having these diseases in our body, but as you get older, you're not moving up. I expect older people develop, and you have some old people don't develop these conditions,
And that's right, because here all the world has changed now. As you rightfully said, back then, we said that, yeah, old people, I'm just using these terms loosely now, guys, so don't take no offense of it. So we used to say, oh, old people get sugar, old people have pressure. And we can understand that because we're moving from a world where, at the time, people just eat, and because of socio-economic reasons, and they could afford it and all of them things there, so they eat what they have. And you guys, and not you guys, but persons who are not knowledgeable. It's like, oh no, we have the information at hand, all a baby can tell about pressure. Then they didn't understand. So them just do as them please, and them do what them can afford, them do everything in them means. 10 pound a dashing, remember say farmer them and all them things there. So yeah, so they're not controlling anything. Right. So then it was higher, but now with technology and education and all these knowledge at hand, persons are now aware. You understand? What now, where we have the younger ones now getting these things, So 12 and 13, your time to see the doctor. So where these children are now having, you can't come back, man. We have one heap of things to talk about. I think I just sugar and pressure alone. We are talking about breast too, right? So we talk about genetics. Those things are in our genetics and we don't know. So if it is that we don't take care of ourselves, it passes right down to our children. They naturally have it, but if they don't care for it from then it's gonna affect us. All right. That is it.
They used to walk 5 miles, go school, and 5 miles come home with our country. And we were healthy, but them people now, them just sit down and just get obese and early diabetes at this young stage.
That is it.
Fast food where they are not burning up, So we have a sick world ahead of us. I don't know. I don't know.
So we as student nurses, we're trying our best to bring all of these information out to the parents, to the young ones, and we're trying to target the younger ones too, so that they can understand. So we have the lazy mothers. But you see, we have to make sure so we don't have a lazy grandmother, because if we have a lazy grandmother, then the mother, they are going to become lazy. And then the grandchild are going to become lazy. And everybody just going to become lazy. We have a lazy generation. You understand? So whatever we know now, we just have to impart it on them. And because they're still young, we are still young, so we just want to make sure, say, we get the knowledge from you guys and you guys get the knowledge from us. I've heard that one, but no, the beer, the beer. Yeah, the Malta of the vitamin and so. Yeah, the beer is fine. The red stripe beer. Look at the fat buckle.
About this and sugar.
You know what I mean, miss? No.
This and sugar.
All right, talk. But you see, I don't mean you're not here.
What sugar? You see? What the normal rate for sugar? Like they must say your diet. When the fully diabetic.
The normal range for your sugar, 4 to 6. Yeah.
That's a normal rate.
Yeah. So if it below 4, too low. If over 6, it's too high. Yeah. Unless you want the other range. What other range? Because maybe she think about the other conversion. GMR. Or them tell us you're 6. Oh, stand down. If you're 6 to 7? No, you're pre-diabetic. So yeah, pre. No man, if your sugar normal. If you do fasting, if you're not diabetic and you do fasting, you're expected to be on the verge or a little bit below because you fast. Right? And if you're between 4 to 6, you're okay. If you're between 4 to 6, you're okay. If you get like a 3 point something, say, because of the pan fasting, yes. So your body feed off of the natural energy and the natural sugar. You understand? Because of your fasting, and that is why you can go on fasting, because the body has all of that in store for you. But if it's a case where now you finish fasting and you start to eat and everything, and you're within normal range, you're good. If it's a case where you keep eating, and other issues within, then it's going to get high if you don't control it. And that is why it's good to do a checkup. So, may I help me, so miss? All right, so, but everybody all right so far, right? All right, good. All right, so global burden. So global burden. So when we talk about global, we talk about worldwide, right? So these diseases are major causes of illness and death worldwide. Managing them places a huge burden on healthcare systems. So we understand that, right? So if we don't control it worldwide, it's going to affect the health system. And how it's going to affect the health system? Because nobody now control them sugar, nobody now control them pressure, everybody gonna clinic overload, and then when it, I not forget admit, The government system, when you go to the government system, when you know how that go. When you know how that go. So if a wheelchair, if a bed, a bed. If a chair, a chair. You understand? So that is not burdening the system. So that is why it is very important for you all to make sure, say, if you don't have the sugar and the pressure, and the doctor prescribe and go to take it, just take the medication on time, make sure you drink the water, make sure the exercise. The exercise, I mean, run up and down, walk around the eyeball 2 times for 30 minutes. And the 10 dumpling no work again. 10 dumpling of like a little baby over there, so. Yeah? I'm just saying. And not even want to eat 10 dumpling. You must eat in moderation, right? So that if you, and it's just natural, guys. If you eat too much of one thing, it's not good. And if you eat too little bit, it's so moderation, balance is it. You understand? A little of this, a little of that. Make sure so we have the vegetable starch, because even though we are trying to burn out the starch, we still need it. Yeah? But we just need to make sure we have this amount, a handful. No, hold on, me. Eh? Now I'm going to talk about prevalence in Jamaica. So in Jamaica, approximately 12% of adults live with diabetes, while 30% have hypertension. Right? So both conditions are more common with age, but are increasingly affecting younger people these days. Right? And it's because of all of the things that we discussed earlier. Exactly. Nah, do it. Tablet in them brain. All right? All right, so some of the risk factors as to what contribute to these or what cause, well, there are risk factors. So genetic predispositions, as I was saying, family, right? Family line. And you know the question we normally ask. You're diabetic? Yeah. Your family diabetic? And they will say, oh, we understand. You understand? And happy, but we want to know, we want to eliminate certain things. We say if a genetic we can't control it, but in the sense where it done gone already, so you just have to try and maintain it. But if a lifestyle choices mean say you don't want to exercise, you don't want to eat right, that no, you know, so you have some work to do. So that we have to fix. So we try to find the risk factors to educate you or to reinforce you of moving forward. So physical inactivity. As we say, the young people them don't want to exercise, the older ones no. But we're trying our best same way to make sure so everybody's on par. So there are some programs and so forth that we implement so that guys, hello. We're having an education session over here. So the physical inactivity, that's a risk factor. Smoking and excessive alcohol use. So while we talk about the one beer, we work with the one beer. Alcohol we are talking about, but it works for some people, right? But too much, as you say, not good. And chronic stress. So I mean, mental, anything else, any other illnesses that will also contribute to it. If it is that that one is not being taken care of. Listen, no water, no chronic man, no water. Eh? Oh. No man, film care special. Yes. All right. So complications and impact. So with diabetes complication. So if unmanaged, diabetes can lead to heart disease, kidney failure, blindness, and nerve damage. Right? Hypertension complications such as increased risk of heart attack, stroke, and can cause kidney and vision problems. So these conditions often lead to costly treatments and reduced quality of life. So when you have it, it means your lifestyle change. So, you know, when you want to socialize and go drink something, or, you know, you have to stay home. And not stay home in the sense where, let me backtrack. The socialization we used to drink, you have to ease off of that, right? And then if it's a case, like, so for example, the younger generation and they develop that and their lifestyle is how they always go out. Because of that now, if they're really strict on managing their lifestyle, then they're not gonna want to go out in the space. And even if they go out in the space, you can that peer pressure can cause on them and them something there. Cause not all of them are gonna want to say, oh, I'm diabetic. Yes. And not all of them are gonna tell them say them sick, so them rather just take away themselves and that no cause, you know, separation and thing.
If I say I drink water often, it's not the truth. Sometimes I all told you, God bless so much water, I drink. And then next time again, I will drink water. Just if I eat a sweetie, I will just drinking water, drinking water, drinking water. Okay.
Drink it. That's right. All right. No problem. That is so true.
Water when I urine, you know, it have that. I mean, it not clear like how it not clear like how it's supposed to clear. So when I look and see it, me say, you're nice, you need to go drink water.
When it's too early, you know what that mean? You not drink no water, right? So you have to make sure it's not concentrated. We can't use the term concentrated, but when you really think about it, if it's too yellow, sort out your water intake, right? Water intake. All right, so we talk about lifestyle changes for prevention. So importance of that is good, right? So reduce on sugars, salts, fats, physical activity recommendation, mental health support to reduce stress and promote wellness. So like Mr. over there, him says some of my things that will take up too much people problem for our head. That is a mental thing. And also to reduce alcohol and tobacco use. All right? So that is it pretty much in a nutshell. So just give me 1 minute. I'm going to come back and ask you all some questions. All right? Hello, good morning. Miss? Yes, miss? Mr. Chumena. Make a right turn on Grandspin. It is a third right, Chartwood Road. All right, all right, all right. So we're having small discussions here. Well, I like it. I like to see it, small discussions. Oh my God. Let me come over this side because I haven't been over this side, you know. So let me ask you, miss, what is diabetes? All right, let me ask you, what is high blood sugar?
Diabetes.
All right. Give me one of the symptoms how you recognize when they have high blood sugar. No, man, how you recognize, right?
High blood sugar. Your vision start to get blurry, and you realize your intake of liquid and whole has increased. Oh, no, it's all right. No.
Well, your heart rate go up. You feel nervous. No. And shaky.
Yes, what you're saying?
How you recognize when somebody have high blood sugar?
One of the things is the thirst, high thirsty, and of course that
The testing, test. Oh, you speak low. No, man, we want everybody here, man.
Okay, thirstiness. Right, and you tend to some, if it's very high, you begin to have a sort of this blurred vision, and you're not stable in sometimes when in terms of walking. Sometimes you get a little bit of dizziness, nauseous. Yeah, that's it.
Okay, that's good. So, when them say people diabetic, they must make nothing cut them and them something. Why you think them say that?
It's a natural thing between the flesh and the bone. So if the bone chronicles are cross, that means that the flesh won't well because the bone abscess thing. So they cut opening back again. So it will be cleanse or cleanse. That means your high blood pressure.
So,
And the joints in for unless you have stitch it or laser beam it and dress it natural or before. Fresh fish and fresh water.
all right, so all in all, the cut take long for heal. All in all, the cut take long for heal. All right, so Miss Eunice, so how do you recognize now when somebody blood sugar is low?
So when they're dizzy, or the blur vision, and this, or you know, you can't, your speech, blur vision, or even, why, that's our points? Those things?
Those are points. Weakness, fatigue, hunger, heartbeat racing. So the coma.
As our pressure was low, and when then go to hospital, she find herself in the car, the neighbor go pull the door, because the daughter call her, but she did neighbor the key, and then go in the ambulance and call, and the hospital she find herself, the pressure went right down, because she used to have to take the thing herself. That's what bad that sugar was.
Okay. So let me just give you oh my God. I'm going to share an experience. So my grandmother, the first time my grandmother went in a coma, and I did not know, right? And all of a sudden, she just looked wild. I mean, I say, oh, she looks so. Me now, I tell her, I start get afraid, because I don't know what, right? And then she have stroke, so one side, and next side. But me, I say, for person who have stroke, and she just draw me up so. Me, I say, no, sir. I'm not going to tell her I'm afraid. Bad. So till she just flip off of the bed. And me, I tell her, say, it was that time. I mean, Mark, you made a call for help and everything. But to see that experience and didn't know and didn't understand. And that is why education is important, Because if I had known that, mother going to get some sugar and gear. You understand? So when she got the doctor and everything and them come back and them tell us, say, our sugar go too low because we are trying to maintain it. But boy, come like say, we are control it too much because it go right down. So anyway, next time now, I'm with her and me realize now, so she start days out and me say, no sir, this not look nice because at this point now the nurse educates her and say, if she look like this and she look like that, this is what we need for them. So she said the sugar and water, the regular black sugar can work, but if you have the glucose, the red and white box, she said if you have that, we can just put that arm out and that do the thing quicker than the other one. But we use what we have. We have black and white sugar, right? Black sugar. So at the time now, I see her and she look wild. And she, and me I said, no sir, go feed sugar, quick, make the quick water sweet. And give it to her. I'm not going to tell her lie, she just kind of start to come back. And I'm saying this to say, when we're educated and we know what we know and we can identify these things, what we need to do is just make sure we always teach people. Anybody who we're living with, make sure them know at least the sign to say, hey, if me look like this, that means say something high or something low. You understand? Because you just want to live somewhere and the people around you don't understand what's happening and can't help you. They might get afraid like me. Right? So when you know, you know. When you can educate. You can impart the knowledge, hopefully, them take it, but if them don't take it, we do what we can do.
When it is low, it's give you actually the same feeling. So how you gonna know when it is high to treat it and when it is low? That's not.
So the thing is now, you're gonna know, in our bag, whether you have sugar or not, because when nice service long, man. See there? That means so that is a saver. You understand? So that will bring it up back until you leave the service. So I'm gonna wrap up now because I realize that you guys are reinforced with information. You build on it. It was a very interactive session. We don't know the discipline. So why you stop? So you know, like the fact that you lose the weight. Yeah, because some persons when they mad, God come up, they want to put on the weight number. When God give them, eat a crackers or something. Can always make sure you eat a crackers. Eat a crackers if you feel, yeah. Or you take a medication. So what about your sugar? Did you eat? Hmm? Yeah, but you have to know now. All right, your pressure, all right. But is it a case where your sugar was too low? When I tell you to eat one big wok of food before you go to bed, but a crackers. No, man. And your sugar being low don't mean you're diabetic. But the body naturally responds to those things. You understand? Because I can tell you, say, hey, me not diabetic, but if me not eat from morning, I can start feel a certain way. So that means say, anytime you me start talk one bag of something that makes sense. I always say, no man, sugar level low. So I just need to go get something to eat. You understand? Start talk bare foolishness. So it not necessarily means say you're diabetic, but naturally your sugar is low. So just eat something. Hmm? Type 1 and type 2. What do you mean by that? If it's okay out of you, now treat it still. You understand? So if you don't take care of yourself, if you go a doctor and the doctor give you medication and you don't take it, of course that's okay out. The numbness, that is a part of it. Those are signs and symptoms. You hear pins and needles? Them something there? When you food you feel, yes. So circulation is the issue for that. So, so when you feel that, you have to make sure you just start walk around because the circulation. You understand? I say you sit down one place too long. And when you have the people in frack for go so, 10 of them, where's if I choir your sofa? Jesus, please. When we're leaving? Okay, so guys, hello. So when you go around to the doctor's office, when you're leaving the doctor's office, you can stop by the canteen and get a cup of soup. All right? So don't leave without the soup, guys. Good soup around there. And it's free of cost. All right? Yellow soup or pigtail soup, miss? Okay, all right. So it's yellow soup, guys. Chicken soup. The soup that everybody drink when them get sick. But nobody's sick right now.
For the physically fat, we recommend Slim Fast. For the sinfully fat, I recommend losing fast. Need help? Well, step into the gym class. Everybody know in. Are you out? 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 Hear me now. If you damn sick till you're fat, you know you need to get sleep. Only question. If you need to make a family, use the word I got to get free. Only question. Some man a grow tired, get fat on the word, but soon him now win. Only question. You better play some gospel reggae, make a exercise good with him. Everybody start warm up. To the Lord, just hold your arm up. Warm up. Remember, he make you stand up. Alright, start switch. Man, the muscle can chat, don't get kicked. Start switch. Remember, him take you from a wrestling to the sky. Start reach to the sky. If you're sinless, around level, we have to hear me. Relax, then punch. To relax, well punch. From up a Christian walk, punch. And you lose bad ways by the bunch. Bad mind if you lose it. Hatred if you lose it. If I anger, lose it. When the why you for no, lose it. Bad heart if you lose it. Bad heart if you lose it. Every time I sit there, I try to hear you do. When the why you do, lose it.
If you know you're waiting in sin, let's go to the gym now. Holy Ghost gym now. Yeah. If your spiritual health is suffering, go to the gym now. Holy Ghost gym now.
If you're damn sick till you're fat and you know you need to get sleep. Holy Ghost gym. If you need to make a flabby, use the word I got to get free. Holy Ghost gym. Some man a go tired, get fat on the word, no soul him now win. Holy Ghost gym. You better play some gospel reggae, make a exercise good with him. Here why? Slandering we give over that. Lazy figure we give over that. Unhealthy word we give over that. If a go say unforgiveness to that. Lusting we give over that. Up the aisle we give over that. Gluttony we give over that. Unforgiveness club the hard not. Here why? Bad mind if you lose it. Hatred if you lose it. If anger, lose it. When the why you for no, lose it. Bad heart if you lose it. Bad heart if you lose it. Every farmer sin we are.
Mic check.
Everybody can hear me? All right, good morning again. So we're going to start off our second presentation and we're going to talk about breast cancer. As my colleague said, it's October, so you know it's breast cancer awareness. Everybody wear pink, everybody wear them little stripe, them pink stripe. And sometimes cancer can be a scary word. That's why we want to raise awareness, talk to you about it. Wait. It is a scary word, right? So we want to talk to you about it. The more information you have, the more you know, the more you can prevent it. All right, so we're going to start off with some facts. So breast cancer in 2022, just 2 years ago, was the most prevalent cancer among women in 157 out of 185 countries. So out of everybody being diagnosed with cancer, it's mostly breast cancer. And 1 out of every 100 cancers, breast cancers that are diagnosed are men. You didn't know that? All right. So who is at risk? Who can get it? We already said females mostly and the men. Having a family history of breast cancer. So if your mother had breast cancer before you, or her mother before, you are at an increased risk of getting breast cancer. That means you must get it, but you can get it. Individuals who are obese. So if you are overweight, and that means that you have more breast tissue where the cancer cells can form. So that increases your risk. If you smoke, smoking again. If you drink, who did say them drink one beer? One beer? How often you drink the one beer? One golak. When name's one swallow. I don't know if I believe you still, but all right. Radiation exposure. What you say? Roots beer. Well, I don't really know the beer them still, but we talk about it. So if you've been exposed to radiation, if you work in a factory, and if your job exposes you to radiation, if you had a cancer before and you know you do chemotherapy, you do radiation, and they put all sorts of waves on you, being exposed to that can increase your risk. Your reproductive history. So if you had your first pregnancy later on in life, your first child you had 36, 37 up, 40, that increases your risk because you know your hormones are lower now and there's less protection against that. Postmenopausal hormone. Who here is going through menopause? The hot flashes and you can't take the yeah. Yeah. So if you decide no, you can't bother with the hot flashes, you see hair up on your chin, you say, whoa, what is man a man? And you decide to go and get hormone therapy, that can increase your risk too of getting breast cancer. So we're going to move into symptoms and indicators. Anybody know some symptoms of breast cancer?
Depends on fluid.
Fluid coming out of the nipple, yes. Abnormal. Losing sight? Not necessarily, no. Boy, I don't know about that one there. Brains, what I can say is glaucoma is a common symptom of high blood pressure. So my grandfather, his pressure high. So that's caused him to get glaucoma. It's affecting his vision, it's blurring his vision. But not necessarily breast cancer. So what she said about the fluid, if you see abnormal fluid coming out of your nipples, if you see fluid with blood in there coming out of your nipples, lumps. And it's not just in your breast, it's under your armpits. So you know you want to feel all around the area. All right, we're going to stick up in front of that. Dimples. If you have dimples in your breast, if your breast feels red, pitting meaning you see little holes, like you press down on your breast, and you see that it's indent, and it takes a long time to come back up. Normally your breast is supposed to be elastic, it's supposed to jump back. Yes, if your nipple is retracted, so if it sinks in, that's why it's important to do a breast exam every day. A self-exam. Who here know how to do a self-exam? We get demonstration. You want to come up and show everybody? Come on. You want to show everybody? No? All right, we can turn and look. Show me again how you check. So she starts at the top and she using her 3 fingers and she going around and press in and where else? Not just the breast, but where else? Under your armpits as well. Feel it come down right around. All right. So we talked about the symptoms. Now, if you wake up one morning, you do your regular breast self-exam and you feel something, what are you going to do? Go to the doctor, right, for a diagnosis. So how is it diagnosed? Self and professional breast exam. So after you do your self-exam, you go to the doctor, they will go on to their own exam, right? You can take a mammogram as well, or a tissue x-ray, or a biopsy, you don't know, or an ultrasonography. So they send sound waves through your breast so they can visualize the lumps and the fluids. You can do a breast MRI. Keep it down, keep it down. You can do a breast MRI to view the images, and you can do a biopsy as well. So there are different stages of breast cancer. Some not so serious, some more serious. You know how many stages we have? 4 stages. Yes. So if you have stage 1 breast cancer, you can say, all right, you feel the lump, you go to the doctor, them say, all right, stage 1. You can go through your chemo radiation, and there's a higher chance for you to come out on the other side quicker and go into remission. But if it's stage 4, then it's much more serious. So the procedures that they might use to stage your breast cancer, if they confirm that you have it, they might do a bone scan. They might do a CT scan, an MRI, you know, the little machine will look like a coffin and you have to lie down and, yeah. Or they might do a PET scan. Now, does anybody want to share their experience? You know, anybody with breast cancer? You ever hear of anybody having breast cancer and them go through the treatment and, you know? If anybody who's been diagnosed with breast cancer? Enough people. So what you hear about it? When them tell you about it? Don't call me.
They feel a lump. No, ma'am, I'm not calling it. They feel a lump, and they go, and the doctor tests it, and they go back, and sometimes it's far gone. The doctor said they're going to take out the lump, send it to the lab, and be tested. Yeah, ma'am.
So they're not going through any treatment or anything? Okay. All right. So we're on to treatment. You have breast cancer. How do you get better? So, to reduce the likelihood that the cancer will return, they combine different treatments. So there's a hospital, we have a cancer hospital in Jamaica, Hope Institute in Papine. That's where a lot of people who've been diagnosed with cancer go, the Hope Institute, and they go through radiation to reduce the risk of recurrence. They go through surgery to remove the breast tumor. What go on over this side? On the lively over here. Radiation therapy, they go through surgery, and they also take drugs. So, you know, chemotherapy. Everybody talk about chemotherapy. The same way you go to the hospital, you get an IV, you get your fluids. That's the same way they deliver the chemotherapy drugs to you. Yes. Yes. So chemo, yeah. Some people feel nauseous, them vomit, them feel weak, and that's why we give you gravel and we give you anti-nausea medication so you don't go through that, or it's less likely for you to go through that. Yeah, so we're going to do a little recap because it's a short presentation. Only breast cancer because it's October. We wanted to raise awareness. You have questions about other cancers? Cervical cancer. Well, cervical cancer is another thing that you have to get diagnosed for. So if you are taking a shower, right, and you feel pain in your genitals, you feel pain down there, you're seeing discharge that's abnormal or spotty. You stop seeing your periods, or your periods are more painful than normal. They lasting longer, they lasting shorter. Anything abnormal with your reproductive system, you go to your doctor and get a physical examination. They get your history. If you have a history of cervical cancer, that increases your risk as well. So you need to talk to your family members, talk to them about what they've been through. Because some people, them go through it and them don't know anything. Them don't get checked out until they wouldn't know.
Sample cells and sample cells and they send it to the lab, and then it's tested, and then if the cells are abnormal, then you can do a follow-up. The doctor will call you back in, and you can get diagnosed from there. So pap smear are normally done like on a yearly basis, depending on your diagnosis. So if you had an abnormal pap smear, the doctor might request that you come in within 6 months or within a year. But if it's normal, then you can do your pap smear like every 3 years. But that's not for you to decide. But when your medical professional do the pap smear, then they can tell you a time frame until when to come back. All right? Right. So it's not only when you are sexually active that you do pap smear, but once you have passed the age of 18, once you have started having sex, even if you stop, but you still need to get a checkup to see, because one of the leading cause of pap smear is the HPV virus, which is the human papilloma virus, and that can cause abnormal cells to grow, which can develop into you having cervical cancer.
So once you pass the age of 35 and up, and you know that your family...
Right. Right. So if
you can get checked earlier. If you know that this cancer runs in your family, you can get checked out earlier as well. So you don't... Yes, and if you have lumpy breasts, you feel a lump, that's painful. All right, so I can tell you, I felt the lumps, personal experience. I felt the lumps until my mother said, and we went. It was just when COVID was coming us, and we went to get it checked out. I did a physical breast exam. I did an ultrasound, and that's how they discovered that it's not cancerous, right? So it's not cancerous cells. It's just fibrous tissue, right? So I would say if you feel that you are at risk, or if you know somebody who feels that they're at risk, go and get you checked out. Don't wait.
Right, yes. So you can change your diet. So like the meat and all of those things, you can cut them out, the grease and the fatty foods, so you can more incorporate like vegetables in your diet and your fruits. All right?
Can it lead to cancer? If you get checked out and they tell you you have these lumps and they're not cancerous, what I can tell you is that no, they can't. They can't. But removing them can increase your risk of getting breast cancer. So if these lumps, if you found fibroids, oh, no. I thought you said the fibers in your breast. Fibroids, no. But that's your choice. That's your choice.
That's so true. That's so true. So as I said, some of these cancers are aggressive, and then it depending on your genetic makeup and how best your body can fight off certain things. Some persons are immunocompromised. That means that their body cannot fight infection. So the least little thing, it just devour the body. So when you can fight that, a next person body really can't do it.
And the cancer cells can spread as well. So she might have taken it off and it's already spread somewhere else. So, yeah. All right. So with later. How early can a mammogram show you? Boy, I mean, I forget to. I'd have to find out. Mrs. Ford, we have a question here. How early can a mammogram show you that you have breast cancer? And then we're going to hear from you.
Good afternoon, everybody. Repeat the question, please. So the mammogram will show you abnormalities. It will not show you cancer. When you have done the mammogram and it shows you abnormalities, you would still have to do a biopsy of that area to determine if it's cancer or not. It's going to show you that something is there. Right, it's going to show you, depending on the size, there are some of them that is so tiny that your hands can't feel it, and the mammogram will pick it up. Then you will do a biopsy of that. The biopsy will tell you what it really is. It shows you the abnormality. Then, after we say, okay, we say, well, look at something right there, so. Then we go further and do a biopsy of that little area, take it to the lab, and the lab will tell you whether it is a cancer cell or it's a normal fibrous cell. But I heard my students talking to you about family history of breast cancer. There is a gene, now we talk about genes called BRCA. There's BRCA1, BRCA2. So if you have BRCA, it is most likely that you will develop cancer later on. So there are labs in Jamaica that does the BRCA gene test. It's very expensive, but at least it can tell you what your risks are so you can take action quite quickly. All right? You're welcome.
All right, so before we close out, we're going to hear from someone. We're going to hear from someone who wants to share her personal experience of breast cancer. All right, so clap her up, clap her up, clap her up.
Me tell them, I didn't come call me. I didn't come call me. She will tell me I have breast cancer. Sit down here, bro. She said, "Mrs. Stand up." Oh, morning or evening? Morning? What time? Okay, howdy everybody. Well, my name is Delos Jones, as you know, and I'm a double breast cancer survivor of 9 years and counting. My sister had breast cancer. She had it for 8 years and she died. So after she died, I went to Canada to the funeral and I went back home. And the American Cancer Society called me and asked me to do a presentation on breast cancer. So during my research of doing the breast cancer presentation, I found, my sister had breast cancer. She had it for 9 years, 8 years. But when I went to funeral and went back to America, I was doing a presentation. I was doing my research, and doing my research, she said to me, "Miss Jones, you want to do the mammogram?" I said, "No, sir, I'm good." And she said, I haven't done anything since I came here. She said, "Go and do it." So during my research now, I went and I did it. And I found out I had it. I had no symptoms, no turning of the nipples, no swelling, no arm, nothing at all. But then when I went and did the mammogram, they said they saw some calcium buildup. So I said to her, "What's the calcium buildup?" She said, 95% of the time, it's not cancerous. So I said to her, "Do it, I am in the 5%. And she was laughing, and she said, "Yes, I'm in the 5%. She said, "Why? Because my sister had it for 9 years. But not 9 years, but she survived for 9 years. So I said, "I can be in the 5. So do it." They did that in-depth mammogram. They don't see anything. They did ultrasound, nothing. So they said, "Miss Jones, what we're going to do a biopsy?" I said, "Okay." After doing the biopsy, they found out I had the cancer. So I took both breasts off. I didn't want to take off one. I didn't want to go and take out anything out of them. I said to her, you hear what Dora tell you? Tell swipe, I don't swipe. I'm telling you, swipe them off. I took everything off. I took both of them off. And it was early stages because it just barely reached stage 1. So it was very early stages. So I'm glad counting 9 took them off. Now I'm alive. No chemo, no radiation. Only 1 tablet, 1 anastrol for 5 years. No chemo, no radiation. So I'm 9 years and counting, girlfriend. And 73, do I look good? Thank you very much.
All right, so we see that it's scary, but there's life, there's hope. Exactly, and the best way to have her experience is to catch it early. Here she said 95%, and she could be in the 5%. So she went and got tested. She found out, she swiped, and here she is. Right. So that's the end of my presentation. If you have any questions, any concerns, we can ask them now to find out your answers. Everybody good? Everybody, all right. 15 and 16, you can go to the doctor now. Huh? Eh. 11?
As a presenter, please, when you're going to finish, emphasize on the people who have never done their mammogram to go and do it. Because then people will since as it's cancer month, encourage them to do it.
For the prostate.
Yes, please and thanks.
Okay. Llcog. You can just take 11 since you want to go. You can call Dolores after. All right, so I've gotten a memo. As a presenter and as somebody who is speaking to you about breast cancer awareness, it is my duty to inform you that if you have never done a mammogram in your life, this is the time to get it. Get one now. Go and get checked out. The Jamaica Cancer Society, where else? Where else you can get a mammogram? Right, Jamaica Cancer Society. You can go there, you can get a mammogram. You can do it private. Okay. Cervical cancer as well. Don't be afraid to touch your bodies. Your bodies are your bodies. Right? This is the body that you were given to live in, and you need to take care of it. Do your breast self-exams. Check your genitals. Right. And for men as well, your prostate. Right. Like, the topic is breast cancer, but we want to cover all the cancers. Prostate cancer is on the rise. There are a lot of men in hospitals right now suffering with it. And early detection can save your life. Right? So go ahead, go to the doctor, get your colonoscopy. We know say it's uncomfortable, but it's for your health. It's for your wealth. Okay? All right. All right. Before we have the next presentation, we want to do a little stretch again? We're ready? Ready for stretch again?
You ever gone for the you went away.
Come again. Stretch out again. Come out of the All right, so everybody remember what we are going to spell out first? What word we're spelling first? Coconuts, yes. Bishop Wilson, will you come and stretch with us? You want to come and stretch with us? Come on.
For the physically fat, we recommend Slim Fast. For the sinfully fat, I recommend losing fast. Need help? Well, step into the gym class. Everybody know in. Are you out? 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 Hear me now. If you damn sick till you're fat, you know you need to get sleep. Holy question. If you need to make a flabby, use the word I got to get free. Holy question. So man I grow tired, get fat on the word, but soon him now win. Holy question. You better play some gospel reggae, make a exercise good with him. Everybody start. Warm up. To the Lord, just hold your arm up. Warm up. Remember him make you stand up. Alright, start switch. Man, the muscle can try to get hit. Start switch. Remember him take you from a restless to the sky. Start reach to the sky. If you're sinless, around everywhere to I hear me. Relax, then punch. To relax, well done. Firm up your Christian walk, crunch. And you lose bad ways by the bunch. Bad mind if you lose it. Hatred if you lose it. If I anger, lose it. When me why you for no, lose it. Bad heart if you lose it. Bad heart if you lose it. Every time I sin, we are trying to hear you don't. When me why you don't lose it.
If you know you're waiting in sin, let's go to the gym now. Holy Ghost gym now. Yeah. If your spiritual health is suffering, go to the gym now. Holy Ghost gym now.
If you damn sick till you're fat, you know you need to get sleep. Holy Ghost gym. If you need to make a flabby, use the word I got to get free. Holy Ghost gym. So man I grow tired, get fat on the word, no soul him now win. Holy Ghost gym. You better play some gospel reggae, make a exercise good with him. Here why? Slandering we give over that. Lazy figure we give over that. Unhealthy word we give over that. You never know say unforgiveness cannot. Lusting we give over that. Up the aisle we give over that. Gluttony we give over that. Unforgiveness clap the heart not. Here why? Bad mind if you lose it. Hatred if you lose it. If anger, lose it. When me why you for no, lose it. Bad heart if you lose it. Bad heart if you lose it. Every farmer sin we are trying to hear you don't. When me why you don't lose it.
If you know that you're waiting in sin, let's go to the gym now. Holy Ghost gym now. Yeah. If your spiritual health is suffering, go to the gym now. Holy Ghost gym now.
Alright then, grab your Bible, then curl. Grab your Bible, then curl. Grab your Bible, then curl. Open it up, preach it to the world. Bend your knee, don't forget. Bend your knee, don't forget. Kneel down, don't forget. No wrong to pray and bust sweat. Like Joseph, run past. Flee from evil, run past. Like Joseph, run past. Take up your foot and run to the cross. Run the race, fast, pray. Run the race, fast and pray. Run the race, fast, pray. Make the devil know say you're not play why. Bad mind you go lose it. Hatred if you lose it. If anger, lose it. When me why you for no, lose it. Bad heart if you lose it. Bad heart if you lose it.